Welcome to the pre-Labor Day amazing sale starting today with Michelle. She's going to do some major announcements here. And, of course, through the weekend, we want to make sure that you travel safely through Labor Day. Remember that it's a time to kind of enjoy your family, the end of summer, last major festival. And, Michelle, you got lots of announcements, so let's get rolling.
Festival, hey?
Yeah, it's festival. It's
like Christmas.
going to the parks, going to the theme parks, hanging around the pool, the barbecue, going to the beach, doing whatever is the end of summer.
Oh, my gosh. Speaking of the pool, I just thought yesterday we were out by the pool, and it was like 5 o'clock, and a king snake came out from some bushes in our yard. And brave as anything, with Bill and Kelsey were still in the pool, and it slithered over to the pool, didn't it? Like it owned it, and went right in the pool with them in it. Now, king snake is the largest snake in Southern California. It actually eats rattlesnakes. Now, I have a snake phobia, so I'm like, oh, was I jumping around with a jackrabbit? But I remembered what the landscaper guy told me, don't kill that snake. It eats rattlesnakes. So I realized it was a friend. But what did it do, Bill? It got in the pool. Go ahead.
It just swam across like it owned the place, and then got out. They put its head on the other side, climbed out, and went down the stairs toward our greenhouse.
Yeah, a lot of snakes drown in the pool, don't they? But in other people's pools, I've never seen a snake in a pool myself.
This snake has been in the territory for a while.
This guy, so he just, I couldn't believe how he put his head up and got out.
We don't have any snake preventive nutraceuticals, though. That's one thing of our drawback. NutriMeds will not prevent, as I call him, I call it the sheriff snake, because he's the sheriff of the town. He's going to make sure you don't have rattlers, because the baby rattlers will release all their venom and then they die. Yeah. The big mama rattlers will bite you, and now, if you don't get treatment right away, you can be really sick. I
wonder how big these king snakes get, being the biggest, because, rattlesnakes are big too, and all gopher snakes are big here. I mean, I've seen it all now over the past, what's going on, 7 years we've been here. But this one I let go and went, okay, you are my friend. You are going to eat up the rattlesnakes.
There you go.
Good grief.
So that's your first announcement. So now how does that tie in with the sale?
I wasn't even thinking of it, except you said the word pool. It reminded me, and I was still
okay. Your mind's still on that. Okay. So what other
Labor Day sale. Labor Day sale.
What is it?
Oh, it's what Dr. DEAGLE made up, the 7 for Heaven sale. 7% off. 7% off of sale prices as well, which is our 3-pack and our 6-pack. And free shipping on everything. And that includes not only Dr. DEAGLE's products, our NutriMeds, but also the Lumen Photon, MagnaSoothe, Silver, Indiamese, Zeolite, all the allergy research, ecological formulas,
everything,
the works.
But
QRMA, it's 27% off.
Wow!
Because I had to add a 7 because we had a special before.
Right. Yeah, excellent. Now, I wanted to also announce that we have, instead of 10% off, if they use the code NutriMed on our Pure Water systems, they get 15%.
Oh, cool.
Right. Yeah, we contribute 3% more, and Bob Vineyard at Pure Water Systems another 2%, so that's 15 just for the weekend.
Yeah.
And if they purchase a Lumen Photon, they're going to get an additional $50 off any of the Lumen Photon machines.
Yeah, well, they've got free shipping. Just the shipping is $35 on those. Yeah. So they get the free shipping plus the 7% off. So that's a good deal. Okay, I had lots of phone calls this week because everybody was coming and going, and with all the company and everything, I think I picked up more calls. So I'll start off with my dear friend Ken. I know everybody goes, Ken, you must talk to him every week. I think I do. Ken will be on the cruise too, but it's a funny thing with Ken, Bill, and I brought you in to talk to him as well about getting 400 to 500 grams of sugar in juice. He's a big guy, and he's well built and all that kind of stuff because he really takes he takes care of himself, right, Bill? But I was wondering why. I guess there's a few little pounds he's trying to get off, and he discovered that he was juicing and taking all these juices and pineapple and orange and juices every day. When he added it up, he said it came to every day 400 to 500 grams of sugar in juice.
Yeah. If you're going to have fruit, have the fruit. I recommend berries and melons and apples. Apples, berries, and melons. Grapefruit's okay, too, because it's basically the sweetness of grapefruit is not sugar, but I'm saying don't have juice. juice is bad. And I like our best is our NutriComplete, which is coming. It's actually in laboratory testing. It'll be.
I'll believe it when I see it.
I was told this week that it's coming, so if you do order it, we will be shipping it for you.
Ken's other question was with the leptin metabolic, because he's a big guy, 6'2", he wanted to know does he take one of those a day or two?
Two.
Oh my goodness!
One twice a day.
30 in a box.
Right. That's initially, and then after he knows that his metabolism is changing because you're trying to change your leptin and insulin resistance. So I recommend initially take for a large person 2.
But someone my size would be 1.
1 is plenty for a smaller person.
Okay. Now from America. America is from Georgia. Works for the government over there.
Uh-huh.
Anyway, she had a bad nail experience, a bad pedicure.
Uh-huh.
And she said it was, can I say where it was? Regal Nails?
I wouldn't say that.
Oh, okay. I won't say that then.
All you would say is that an accident happened and a cut was made down to the bone. And
that's right. And nothing would heal it. Antibiotics, doctors are giving her everything. So she is now starting on a program of?
Which will be on Allicin topically, Nutriodine, to reduce inflammation, local curcumin, and the Magna Smooth. She'll do very well. The combination will knock out the inflammation. And because the Nutriodine and the Allicin will penetrate the biofilm like antibiotics doesn't, it'll heal it up pretty quickly. And
she wanted me to give you a praise report because you saved her from the pain of arthritis. She's been on our protocol for arthritis for a couple of years.
Good.
Yeah, no drugs.
Yeah, excellent. Yeah, because the disease-modifying drugs also increase risk of cancer because they suppress your immune system, and your cancer surveillance system is gone, and your ability to eliminate cancer cells or repair them. So when you take our natural nutraceuticals, whether you have cancer, like I did a consult this morning, and the gentleman, I said, yes, do go to your colonoscopy, but if your test shows positive on the colonoscopy, the gold standard is a CT scan, spiral CT, and PET scan to see if there's mets, and take all of our cancer nutraceuticals, high-dose Power C and full vitamin K2, and we'll give you alternative clinics to plug into to get care. But do not do radiation therapy. Don't do paint-by-numbers chemotherapy. It should be gene-based. And, the whole problem is that there are good things in medicine and surgery, and there's bad things that shouldn't be done.
Did I say when the Labor Day sale is? It started today, this morning, just before I went on the air, and it will end at midnight on Monday. However, those of you that don't, I know.
Yeah.
Those of you that don't use the computer, I will still honor it on Tuesday.
My guess is you'll still have it up on Tuesday morning. When you're getting calls.
I can't say no. People can only do by phone because we won't be answering the phone until Tuesday morning. So if we were answering the phone Monday, that'd be different. But that's not going to happen.
You're not going to
happen. Not in this lifetime.
Not working on Labor Day, no.
Our next bill is Ruth. Hi, Ruth from Missouri. Ruth has a problem, Bill, because she has a prolapse, her bladder and vagina prolapse. Yeah. And they want to do surgery. And she wanted me to ask you if there's anything else that she could do besides having surgery, like an inversion table or something like that.
Well, Kegel exercises will strengthen the muscles to some extent, and collagen max will improve the connective tissues.
She's tried that, but that's not working.
Yeah, then she'll probably need surgery. But even if she does the surgery, if she doesn't increase her strength of her connective tissues, it'll prolapse. So Kegel exercises, probably surgery, Kegel exercises, and collagen max will strengthen her connective tissues.
What about the inversion table she was asking about?
No.
Does that do anything?
It'll make it fall back, but then if the ligaments are too strained,
it's just going to do the same.
And if the bladder falls, you lose bladder control because the bladder falls through the peritoneal wall, and then you don't have ability to put enough pressure to prevent urine from leaking out.
I talked to Barbara. Hi, Barbara, down in San Diego, my neighbor. She was telling me, and I found this interesting, that older people that get dental, most everyone, she said, in their 70s and 80s, high percentage, have dental infection, which leads to their death.
Right, it leads to heart disease. Same nanobacteria growing right in your teeth, grow in your arteries, in your heart, your brain, your kidneys, and elsewhere.
Wow.
And if you take our antipathogenics, Allicin Med, Alamax, Nutriodine, Silver 100, it kills off the nanobacteria and prevents that. Hello, Michelle. You have some more questions of our firing line audience out there that either emails or calls our order line, 888-212-8871. And what kinds of questions do they have?
don't forget the Labor Day sale. This is your chance to get your 7% off and free shipping. If you've never ordered, don't forget, this is your chance.
7% on top of previous sale prices. For example, if you have a 6-pack with free shipping and an extra bottle or whole container, let's say of Ageless Energize, you get also an additional 7% on top of that. So it's a sale on top of previous sales. Nothing like it.
Nothing like it. Look at you. Your eyes are so big. Ooh.
Just like an owl. Hoo. We used to do that little book for Augusta and the Firefly with our oldest now.
Now we're going off on a big rabbit trail, right?
Yeah, there you go.
That's because Matthew was just here. It's a book we used to read to Matthew. He loved it. Let's start with Mike Bill in an email. Dr. Bill, can you build strength in your 50s, and what are the directions to take?
Firstly, you want to release growth hormones, so use microdose, 5 sprays before breakfast and bed and before exercise, and Supernox 2 capsules 3 times a day or 3 twice a day. You want to build up collagen and elastin and your tissues, so I'd recommend Collagen Max, Mountain Red Velvet, 1 Collagen Max twice a day, Mountain Red Velvet 3 twice a day. And then to protect your joints and your ligaments, I'd use Tendon Bender Joint Performance, Mountain Red, and that should do the trick. Of course, you need general support, which is Vitamin Mineral Max. You can use our drinks to increase protein and mineral absorption. If your minerals aren't optimized, you're not going to build strength and true organ, resilience. Mm-hmm. Total body magnesium is very important for people working out because they often lose magnesium when you exercise. So magnesium glycinate malate, number 1, magnesium taurate, and of course all the minerals, Vitamin Mineral Max, Minerals Plus. If you do that and you take our drinks like smoothies, Ageless Life Support Glycemics, you're going to do fantastic. And I tell people, optimize your hormones. If your male hormones are low, you want to firstly take Men's Max, and you can, if your male hormones are still low, enhance for men. We use DHEA and pregnenolone and adrenal support for the adrenal glands. You've got to make sure your hormones are in their optimal condition. I recommend a QRMA is the best machine for that, and I'll do free consults for you and your family. And it'll determine if you're on the right track. Because, by the way, you'll save a lot of money in the long run. We have people who started last year, and they're now on 1/3 the supplements they would otherwise be on. Mm-hmm. And they're now on the ones they need, not ones they don't need, and their health is improved.
That's good to hear. I like to hear that.
So it makes a big difference. In the long run, you save a lot of money, and you can take exactly what you require, and it's, of course, going to be different for every relative. Because their testing will be completely different.
Next is, I'm not sure how to say that name, Jaconia or something, Bill? Jaconia? Jacona. Anyways, but it's A-H, N-I-A-H. Anyways, Dr. DEAGLE, I know you're a busy man, but if it's not too much to ask, please respond to my inquiry regarding Cardivite. What is in it, and what does it do?
Gee, we go over that almost every week. If they need to listen to the program.
Real brief.
It has 7 herbs that basically are going to be the most researched and the most validated with high-pressure chromatography to detox the body, to stimulate nitric oxide, to pull out heavy metals and free iron, to stimulate your stem cells, to improve microcirculation and blood flow.
It's a great all-round product.
Yeah, I tell people every adult should be taking it over age 20. It really helps because a lot of people, heart disease sneaks up and bites them, and they don't realize it takes 20 years of kind of negligence without symptoms to get into trouble, whether it's a risk of stroke or heart attack or other problems.
And by the way, it is on sale on our Labor Day sale. 1 bottle, 3 bottles, 7% off the sale price for 3 or 6 bottles.
And the drops are equivalent to the capsules, so I take caps. 3 caps twice a day because I think twice a day is easier for someone like myself that's busy. 3 times a day sometimes is tough for people to remember.
Here's our friend from Malaysia again. Let's see if I say his name right. Wu Yi Lim.
You did good.
Dear Michelle and Dr. DEAGLE, greetings from Malaysia again, and thank you for taking the time to read and answer my questions. It's a pleasure. I love to make sure I read the especially from him and people that are far away, because it's so cool that they're listening away over there in Malaysia. Will the immunoglobulin in Immunomax be denatured once it is exposed to stomach acid, which has a pH 0 to 1?
No. Immunoglobulins are very stomach resistant, and they're going to be absorbed by the small bowel.
And Mrs. DEAGLE, what type of oil do you use when you cook at home? Dr. DEAGLE mentioned that many types of oil have oxidized cholesterol and trans fatty acids. I like to use butter, Butter, good old butter.
Coconut oil.
Coconut oil I use as well, and sometimes, once in a while, I use peanut oil.
Yeah.
But mostly I use
most
butter
of the time not peanut oil. Because the peanut oil costs...
I know, Bill doesn't like it, but I sneak in the
peanut oil,
peanut oil.
Peanut oil, canola oil, soy oil, and safflower are all polyunsaturates, and in heating they turn to trans fats.
I put it in my
They're
popcorn.
inflammatory.
I put it in my popcorn.
I don't need popcorn, so...
I think you're safe.
Yeah, I'm safe.
The rest of the time you're getting butter.
I'm a non-popcorn person.
Okay,
so that's probably why I don't notice it.
Probably. I like to live in the fast lane. A little risky. A little risky.
The inflammatory
lane. Peanut oil.
I call it the inflammatory lane.
Very funny, Bill.
Well, I am funny in a kind of a dark way sometimes.
Brenda, you're making me think I should put that in your food by surprise. No, I wouldn't do that. I know, and besides, you know what? When you're cooking, I find butter is just a beautiful flavor. I love using butter.
Butter is good. It's a non-saturated fat, 8 carbons, so it's easy to metabolize. So I like my two favorites are coconut oil and butter for cooking, but for extra virgin olive oil for salads and things like that. Oh
yes, I forgot olive oil, but I use that in salads. But I do use olive oil as well. I forgot.
Olive oil
cook with it.
It's good for salads.
I love to use it in my salad dressings, making homemade salad
dressings. Yeah, go ahead.
I almost forgot coconut. When we were at Disneyland, they had an organic popcorn there. I love popcorn.
Which cooked in coconut oil.
And it was done in coconut oil.
You should stuff the peanut oil and move
yes.
Because coconut has much better flavor than peanut oil.
But the flavor was, goodness, it was the best popcorn
I think they might have put a little bit of cane sugar in there. But it wasn't...
They probably did.
By the way, people don't realize if you're having what's called the mercury alkali extracted high fructose corn syrup, that the average person is intaking as much as equivalent in their daily food intake as 1 to 2 amalgams of mercury per day.
In high fructose corn syrup.
Yeah, it's really bad. I mean, anybody who's eating high fructose corn syrup is literally eating straight up methyl mercury. Very bad.
I avoid that like the plague. We have nothing, zero in our entire
really
house
deadly,
that has that. And you know what else we have nothing, zero of? MSG. And then you told me that MSG is
29 different names. It's hidden like
what's that? Hydrolyzed or whatever.
Hydrolyzed vegetable protein. All kinds of. There's 29 different names. You actually look up under the internet for all the different pseudonames of MSG. It's obscene. It should be a crime actually to put it in the food.
Well, we should know what they are.
It is a neurotoxin.
We should know what they are because you know how much
it's a distant relative of Splenda and aspartame, if you want to call it. And they'll put punch holes in your brain. They actually did studies on small mammals, and they found it actually on scanning EM, it actually punctures holes in their brain. Bad stuff.
Next is Brenda in an email. My son is using Adderall for his ADHD. I feel it is habit forming and want him to take your NutriMeds instead.
Yes, we have much better.
Can you please recommend 3 to 4 NutriMeds that he can take instead of the drug amphetamine and dextroamphetamine?
Yeah, Narival.
What?
Let me give you a quick.
Okay.
Narival, Cognition Plus, Synaptin, and ALC 1000.
Okay, good. That was 4, wasn't it?
Yeah. Welcome back, Michelle. We have lots of questions left to answer in 2 segments.
Brenda also asked Bill about her son. He had a steroid shot in his elbow for pain, and she said, I've heard you talk about Tendon Mender, Collagen Max, and do you recommend anything else?
Yeah, Inflamex. What happens is Tendon Mender changes epigenetically the tenocytes, which are modified fibroblasts, so they reduce their swelling, go back to normal and generate normal high tensile strength collagen and elastin. And the Inflamex stops the interfascial adhesions and inflammation where the fibroblasts generate I call fuzzy crosslinks between different fascial planes, and tissue inflammation and compartment swelling that pinches nerves. So that's the Tendon Mender, Joint Performance, and Collagen Max and Inflamex. So the combination of good after injury.
Next is Jessica Bill from Virginia. Good evening, Dr. DEAGLE. I'm grateful you're willing to help answer my questions. To begin, I have had active Lyme disease for about 6 years, a few years of antibiotic use and 2 rounds of PIC IV therapy.
Which are totally useless, by the way.
And then she says, as a result of that, she said she's got chronic fatigue syndrome and postural
hypotension, orthostatic hypotension, yeah. It's an autonomic disorder that's caused by the chronic infection affecting her mitochondria.
Now, her question is, I've been taking your product Nutridyne for several months now, taking 2 to 3 drops in a 6-ounce of
That's a baby dose. You need to take 10 to 20 drops 3 times a day to knock out the pathogen. And then you have to deal with mitochondria. I start off with IBS Care, CoQ10 Supreme, CoQ10 Ubiquin, all those are the core. Then Cognition Plus for the brain, because it has brain effects from the cytokines from your immune system, and antipathogenics. And you want ones, doctor ones are useless. They will not penetrate the biofilm, or the intracellular pathogens, which is what Lyme is. It's an intracellular spirochete.
You know what she says? She has a very sensitive immune system, and whether it's antibiotics or homeopathic, I generally need to allow a buildup of the product in my system over time before hitting a full dose. She calls it a Hertz reaction.
Yeah, we can stop that if you take high-dose Power C, at least 3 capsules 3 times a day with full vitamin K2-1 capsule. Allergon and Allerblock.
Is good for that. Nutritrala.
Nutritrala stops free radicals, yes.
Yeah.
And cell detox, glutathione, Regenerex, those 3 biggies. You don't want to be backing off. You want to actually have total protection and then start your antipathogenics at full dose. And if you block it with Allergon and Allerblock and the Power C, you'll be fine.
She goes on to say she's ordered the Mountain Red Deer, and how much should she take of that?
3 capsules twice a day, but that's a secondary level. The first level is to get control of the cytokines with the Power C and the cell detox glutathione, Nutritrala, Regenerex. Second level is to get the antipathogenics in there, like right afterward, but within a day, and start knocking out the Lyme disease intracellular pathogens. And third is to start using things like Cognition Plus, Brain Power, Synaptin, and things to improve brain function. That's how you get better.
Yeah.
It's a complex problem.
Start off with the Power C, though, and get herself...
if you're going to talk about absolute core, Power C, Cognition Plus, Allison Med. If you just took those 3, and maybe Nutridyne.
She thanked you, Bill, for your time and consideration.
Yeah, it'll knock it out. The thing is, the conventional approach to it is relatively useless, and it actually can be dangerous, because when you take antibiotics that are typically given by doctors, they cause the overgrowth of anaerobic organisms and fungi in the gut, and will cause a more severe dysbiosis. And you can see it in our organic acid tests, like the organics done at Genova Labs. So,
she also says, may the Lord bless your weekend and your health. Thank you, Jessica. And she, of course, has John 3:16 attached to her email, which I love, which is, for God so loved the world that he gave his only begotten Son, that whosoever believeth in him should not perish, but have everlasting life. Remember?
Yeah, hand over your sickness to God.
To have that, 3:16.
Hand over your sickness to God, and he'll provide a way. And he has. Your prayers are answered in our program, in our ministry, to you and to other people. And, of course, the books will be coming out on, I call it Dr. You, how to become the best doctor for you on earth, which is to get trained by listening to the program and reading the books.
Patrick Jr. from Colorado. Graying hair. Is there anything you can do about graying hair?
Graying hair is due to a manganese deficiency, and it's necessary for the pigment formation and melanin in your hair. If you take our Minerals Plus, it'll help that, and then also for hair growth, I'd recommend the Recidivil Hair Tonic and Collagen Max.
Well, I've heard from customers that the Indiamese has made a difference.
It does. And Indiamese will actually recolor your hair because it increases intracellular manganese in your hair follicles.
So if you had to pick 2?
Indiamese and Collagen Max.
Okay.
And the third would be Recidivil Hair Tonic.
Next is Alex from Mexico. Hi, Dr. Deagle. My mother was diagnosed with lymphoma cancer last year in December. It was detected too soon, or this kind of broken English.
Yeah.
She had 6 chemotherapies, according to the best cancer doctor here in Mexico. Now she has
apparently she has some kind of recurrence of thyroid.
Difficulty,
Yeah, you don't know if it's a lymphoma or if it's a separate thyroid cancer. I read that earlier.
Yeah.
And my guess is that it may be a separate cancer, like a thyroid cancer rather than lymphoma. First off, all cancer basically is...
She still has cancer in the thyroid.
Yeah, my guess it's a separate cancer rather than lymphoma, although it could be wrong based on the broken English there. If it's a lymphoma, what we do is you starve the cancer with things like glycemics, a ketogenic alkaline diet, and use all of our nutraceuticals, include Malignablock high dosage, ellagic acid high dose, Maligna Rest, strip off the fibronectin capsule in the tumor and secondary, even non-solid tumors with Inflamex. Use high dose Power C, 40 to 60 gram equivalents a day with full vitamin K2. And we have special clinics that we would plug you into that can help you get well. Gene-based therapy, vitamin B17, hyperthermia, all kinds of approaches, but I do not recommend ever proton therapy or radiation or paint-by-numbers chemo. You want to get gene-based cancer therapy if you have it done. There's testing labs in South America, in Sao Paulo, Brazil, in Mexico, and in Europe, as well, of course, as Dr. Brzezinski's clinic, which utilizes a lab in Phoenix, Arizona. They can take the biopsy and analyze the genes and tell you which drugs will help to turn the gene back to normal.
Next is Brad from Nevada. My mom, 78, has arthritis and is in so much pain, and her fingers are shriveling and shrinking, and she's taking prednisone.
Yeah, prednisone will actually cause more decalcification of her joints and destruction of her ability to regenerate cartilage. So first off, you get off the prednisone. You take Inflamex, topically rub on curcumin and Magnus Smooth, which is Arnica montana. Take Tendon Bender Joint Performance, Collagen Max, and Mountain Red Velvet, and the inflammation will go away, and also cell defense. And arthritis is pretty straightforward. You also want to reduce what's called the biotoxin load in the body that triggers off arthritis with things like leptin metabolic and antipathogenics like Nutridyne, Silver 100, and Allicin Med. Because it turns out your load in your GI tract is the primary trigger off for arthritis. And also if you have insulin and leptin resistance.
His wife has kidney stones?
Magnesium potassium citrate will stop stone formation, and BioLVR because of
potassium
citrate, and also BioLVR and Samethyl will prevent the methylation, will stop uric acid and other forms of stones like calcium oxalate. So the BioLVR are very important because of the pyridoxal phosphate that's activated, B12 and folic acid, and the Samethyl, as well as the most important is the magnesium potassium citrate, and you need at least 2 or 3 capsules twice a day to stop stone formation.
Next is Michael. He says, hello, Mr. and Mrs. DEAGLE and staff. I use Calm Mind, BH4 Biopterin, Cognition Plus, and Brain Power with our older son with very good results.
Yeah.
I also drink a glycemic shake
results
every day.
Probably, are they talking about autism probably, or Asperger's syndrome?
Just hold on, Bill.
Good results.
Okay, wait a minute. I also very much enjoy your radio show and have learned much in the historical and spiritual sense. I have a question about our friend's 10-year-old son. He frequently vomits. He almost always has phlegm in his throat and chest, and he was recently diagnosed with hand, foot, and mouth disease. He was also recently diagnosed with Tourette's as a result of the phlegm. But our friend is not sure that diagnosis is correct.
No, I don't know who they can talk. No, it doesn't make sense.
Yeah.
First off, Tourette's syndrome is a seizure disorder in the subthalamic nucleus, and they have actually what's called coprolalia, where they actually have what we call dirty speech. It's a seizure disorder in the base of the brain. What we do is we use anti-seizure approaches, a ketogenic alkaline diet, Cognition Plus, things to reduce brain inflammation like cell defense, Nutritrala, Regenerex, and cell detox glutathione. And then the proper fatty acids for brain development, Neurogen, Nutrifos, and Omega Supreme Krill, Omega Cod Liver Liquid.
That's a lot of stuff.
Yeah. Welcome back, and a happy Labor Day holiday weekend, and happy 7 for Heaven sale as well, which is going to go on from today through to midnight on Monday, and I'm sure it'll actually continue Tuesday for those people who don't go on the internet or place verbal orders by phone.
Hey, Bill, for Michael that we were just talking about, that little boy that had the Tourette's, he also wanted to know about the phlegm and frequent vomiting. He said he's been doing that for...
Well, it needs more investigations. I need more questions. First off, if you get frequent vomiting, you can have postnasal drainage, chronic sinus infections and or allergies, or fungal infection. Mm-hmm. And you could have acid reflux, for example, so they may need to do what we call a capsule test, which can be done by a pediatric gastroenterologist. So the problem is a lot of the basic, what we call advanced medical, is not done correctly. And then the alternative therapies are available, which are much safer than drug therapies.
Next, Bill, is Blake in an email. Dear Dr. DEAGLE, I've been listening to your show and I really appreciate your discussions. I'm interested in ordering products from you. My wife and I are trying to conceive for the first time. We are both in our mid-40s and in excellent health. She has been seeing a fertility doctor, Western, as well as a Chinese fertility doctor for the past 4 years. Her eggs are considered healthy, and so is my sperm. We've been tested for this, yet still can't conceive. She has gotten pregnant 2 times in the past 4 years, but both ended in a miscarriage. We tried in vitro, and it also failed. Do you have any products that assist with fertility?
First, you got to have more data. what you need to do is salivary levels of hormones, especially progesterone, and it'll determine whether or not she's able to maintain. The reason why it's called progesterone is progestation. In the first third of pregnancy, the progesterone levels that your body produces protects the pregnancy so you don't miscarry. After that, the trophoblast actually generates human chorionic gonadotropin that takes over from the second and third trimesters. So the first trimester miscarriages are due to one of two causes: trisomies, which are trisomy 13, 18, and 21, which is Down syndrome, and the most common cause otherwise is low progesterone, and that's easy to fix with DHEA and pregnenolone, which we have tablets of. But you want to do a salivary test, and you can go to labtestingdirect.com and order the salivary test over a period of a month to look at your female hormone levels and find out exactly where the deficiency is in the cycle. My guess is its progesterone levels are low, and that can be fixed with topical progesterone, like our femgesterone cream, which we carry, and that will actually be progestational. If you're healthy otherwise and you don't have antibodies against the sperm, you don't have any kind of pelvic inflammatory disease or Asherman syndrome where they scrape the inside of the uterus for a previous abortion, or a DNC, then there's still a good lining inside the uterus. There should be no reason why if there's proper hormones.
Okay. Next, Bill, is Joanne from right here up the road in California. Hi, Joanne. Hello, Dr. Bill and Michelle. Hope all is well with you and your family. I've been taking NutriMeds for about 1.5 years now, and the QRMA has been such an amazing device to assist me in tracking my progress, and I'm more self-reliant in managing my health. I sent my first QRMA report back in January this year, and since then I've improved in many areas such as cardiovascular and bone health. Now, she says, my major complaint she wants to deal with, Bill, is depression, bloating and uncomfortable stomach, fatigue, and inability to lose weight.
The first is depression, BH4 biopterin and S-methyl, Cognition Plus, those three. The abdominal bloating, IBS Care, which is the slow-reacting released propionyl carnitine, Ageless, which contains the immunoglobulins, the Ageless vanilla or chocolate, which has also immunoglobulins to heal the gut, and the Living Probiotic Ultra every second or third day. And for the excessive weight, that's basically pre-diabetes insulin resistance, so leptin metabolic, 1 capsule once or twice a day, diabetoline, 2 capsules twice a day, biotin plus 1 twice a day, Lipo Flush, 2 soft gels twice a day, and vibrational exercise, and that should start to reverse the metabolism and raise the insulin sensitivity, leptin sensitivity, so it'll start to control appetite and normalize the gut peptides. Okay. So usually you're dealing with a pre-diabetic condition or elevated insulin and leptin resistance.
Next is Peter from Australia. Dear Dr. DEAGLE, I've just finished viewing your YouTube videos connecting the dots, and you give an awesome presentation. In part 3.5, you caught my attention big time when you mentioned your Lyme disease products based on the allicin and silver. I'm very interested in purchasing the correct products for this. My girlfriend's in the States, and she's a chronic sufferer over 20 years. She's had a number of infections and neuropathy as well, Bill, and lethargy. And the purpose of this email is to ask for your specific product recommendation. She's 47 with over 20 years, as we just said, right? Could you please let me know, and I'll let you.
Yeah, intracellular pathogens have been researched by the Germans since the 1930s with mycoplasma. And they generate abnormal surface antigens that can trigger off autoimmune disease and cancer. Lyme disease is similar. The cytokines deplete neurotransmitters in the brain. They release cytokines that interfere with mitochondria, so energetic levels are low. To make the body acid rather than alkaline, and also weaken it so it builds up biotoxins, chemicals, and such as radiotoxins like heavy metals and radiotoxins from Fukushima. So as we start to correct them with things like Cognition Plus, mitochondria with IBS Care, and CoQ10, ubiquinol, we get the body in an alkaline state with Power C Plus and full vitamin K2. And then we reduce free radicals with Nutritrella, Cell Detox Glutathione, and Regenerex. The person starts to get better, and we use a triple threat against the pathogens because they're intracellular. High-dose Nutridine, at least 20 drops 3 times a day. Allicin Med, 2 capsules 3 times a day, and Silver 100, 1 spray or 3 drops per 10 pounds body weight under the tongue 3 times a day. And usually within a matter of a couple of weeks, they start to show significant improvement. You need to continue on it. There's no such thing as, quote, a cure. You can get the condition into remission after usually 4 to 6 weeks, and you'll get better.
Okay. Next is Trevor in an email. Could Dr. Deagle please confirm if I can give up my Plavix, a blood thinner, and replace it with Cardivite?
Yes, and you want to add to that nattokinase. Cardivite, nattokinase. Plavix is useless. It's called clopidogrel. It was never really very good for doing its job. And some of the newer drugs like Xarelto are plain dangerous. They're not as effective as even the nasty, we call rat poison drugs like Coumadin, and they're having some major suits against Xarelto.
Another drug question, TJ from Georgia. Right here, you give me the links to the nastiness of the drug? What's that?
Carvedilol.
So I can share it with my Georgia cardiologist.
Sure. That information, by the way.
She asked for it.
Yeah. What they can do is, I'll post that up. Carvedilol, basically, what it does is it blocks the activity of the gamma E plus tocopherols and nitric oxide metabolism and damages ion channels in the heart.
Next is Carol.
So Carvedilol actually causes some damage in the areas where it's being used, particularly for heart failure.
Yeah.
It actually increases some of the metabolic underlying problems that cause heart failure.
Yeah, wow.
Yeah.
Next, Bill, is Carol from Indiana. Hi, Carol. Carol's been around for many years, Bill. Does Dr. Bill know what settings are to be used on the original VibraSlim, which would be best for losing weight and also for flushing lymphatics?
Maximum, the original VibraSlim is a tilt machine. You want to put it on its maximum frequency, maximum energy.
Okay.
Yep.
Next is Nick in an email. My mom has been on your diabetes protocol for 3 months. She's also taking a drug called, what's that, Actigol or something? For preventing gallstones.
It's ursodeoxycholic acid, which basically prevents gallstone formation. Yeah.
Is that going to interfere with her?
No, it doesn't. No. It takes a while, too, because your body has to respond by lowering insulin resistance, and you need basically a low glycemic diet, like a George Cruz type diet, and use a carbo block, basically diabetoline, the Biotin Plus, Lipo Flush, and Minerals Plus, Chromium Cruciferate, and the insulin resistance will drop. But you need exercise, and I recommend the vibrational exercise is probably best for normalizing gut peptides and lowering insulin resistance. And by the way, besides ursodeoxycholic acid, you can use for gallstones too. You can use the magnesium potassium citrate. It stops kidney and gallstone formation. So the ursodeoxycholic acid actually does work. But I think that the problem with using any of these things is when you use the toxic drugs, there's often side effects, whereas magnesium potassium citrate
she was about losing weight, right?
Yeah, first off, to lose weight, what you want to do is you want to do something that stimulates your metabolism. You've got to make sure your thyroid's properly converting, so you got to make sure you have adequate levels of selenium to convert peripheral thyroid, adequate minerals, Vitamin Mineral Max, Minerals Plus, adequate exercise, and I recommend the vibrational 10 minutes a day is equivalent to an hour of aerobic stimulation of your metabolism.
Glycemics is really good.
Glycemics and carbo block before every meal, because you got to block the carbohydrates.
And what about the leptin metabolic, though?
Leptin metabolic. The insulin surge will block your calories and push it into fat storage. So what you do is the carbo block and the glycemics are really good for that.
Give your email.
Yeah.
Anyways, my dears out there, don't forget that the Labor Day sale is on, and we've got the 7 for Heaven, Bill's invention. And it's a blessing for you and a blessing for us to be able to help you. Well, of course, have a great weekend, a long weekend for most people. Yeah, I think that's what excites you so much, because you're smiling and think, my job's done now. I just love the weekend. You can do Kelsey's hair and get ready. God bless you.